Placement using what's called the anterior approach procedure has been gaining popularity recently. We spoke with Dr. Louis Stabile of Desert Regional Medical Center in Palm Springs, who told us why this procedure has become so popular.
Standard hip replacement is what's typically done, but I do what's called an anterior total hip replacement. It's similar in terms of replacing the bones and reconstructing the joint. It's arthritic and painful by putting implants in, but it's the way you do it, it's a little different.
We asked Dr. Stabile how long this procedure has been used.
It's not a secret, it's been around for a while. It's just starting to catch fire a little bit, and a lot more people are doing it. It involves usually going through the front of the hip, which is much more atypical for doing hip replacements than going traditionally through the back of the hip.
The doctor told us why the anterior procedure is better than the posterior procedure.
It's better because it uses a natural plane between two muscles without having to split any muscles, without having to take any tendons off. So it's definitely a much more natural approach. If you operate through the back of the hip, people sit on their incision. They sit on the area you've traumatized and damaged to put their hip in place, so that tends to hurt more. Whereas if people sit and you operate through the front, it tends to relax the incision, not stretch it out. People have more comfort after surgery. So in general, I think patients recover a lot quicker. They're able to walk independently. Some patients walk independently very quickly.
Dr. Stabile told us what he's looking for after such a surgery.
The other thing I'd like to see is stability after hip replacements. Every doctor wants to see stability after hip replacements. So the best way to get stability is to operate from the side that stability isn't necessarily required. So very few hips pop out the front, almost none do. So traditional dislocations that can happen of hips popping out happen out the back. So if you never disturb the back, you make it much less likely that people have dislocations, and I haven't had any yet. One of my patients, famous baseball player Steve Garvey, was absolutely amazing after recovery. This is one of those things where people say results not typical. However, patients do very, very well, but he's exceptional.
People are just amazed at how well I progressed and how quickly. Former teammate of mine had his hip done 2 months prior, but had the posterior done, and was actually on a cane at 6 weeks. So when he saw me about the second week mark, he goes, "Where's your cane? Where's your walker?" I said, "You know what? Haven't needed it." And he gave me that look. "Are you kidding me?" So the anterior procedure, which has been an evolution over the last 10 years, really has been amazing. And like Dr. Louis Stabile says, it's minimally invasive, and he's able to go in there and really secure the hip. And by the time the procedure's done and you take that first step, you realize that this is the new wave of the future.
At least 95% of patients have good or excellent results and are extremely satisfied with hip replacement. Those are something that equal any other operation, such as heart bypass or any other type of operations offered in medicine. So hip replacement surgery is one of the most satisfying operations for the patient and certainly for the physician. I mean, it's one of anterior hip replacements is something I really love to do, I enjoy. It's something that really gives me a great feeling of satisfaction, and patients just love it. I enjoy seeing is the patients who have had theirs done traditionally had the second one done anteriorly, and they compare it to, and I said, why did it ever get done before that way, you know? So they're very, it does its own advertising. It's great.